Hey everyone, what's going on? Welcome back to the Student Speak series. In this episode, we got Loma Linda, Sacramento State, and University of Maryland, Baltimore representing their physical therapy school program. So, if you're a pre-physical therapy school student, then watch this video all the way to the end because you're gonna gain a ton of value. Lego! Do you want to learn everything you need to know to get accepted into DPT school? If you're confused about exactly which prerequisites to take or where to focus your attention on the DPT application, then consider taking my course. This course will cover tips and strategies for each aspect of the DPT application, where you will be equipped to understand everything you need to know to get accepted into your dream school DPT program. And right now, you could get this course at a discount for a limited time. Click below for more details. Yo, what's going on? My name is Dr. Live for Change, or you can call me Justin Lee. Here on this channel, you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. This series, the Student Speak series, helps you, pre-physical therapy students, gain insight into which DPT program that you want to get into. So, I created the Student Speak series so you, as a pre-physical therapy student, can learn about student experience. Alright, so the three students that are representing the three schools in this program are Zaniah from Loma Linda University, which is located in Loma Linda, California. We have Shireen from Sacramento State, from Sacramento, California. And we have Jin from University of Maryland, Baltimore, in Baltimore, Maryland. So, as you're watching this video and you're gaining a lot of insight and you're vibing with some of these students, I'm going to put their information in the description below, so feel free to show them some love, give them a follow, give them some hearts, give them some likes, comment on their stuff, and get in contact with them, network with them, ask them some questions. They'd love to answer your questions and any concerns that you may have. Alright, we're going to get started in Loma Linda. Zaniah, you're up.
Hello, my name is Zaniah Bradshaw and I am a second year student at Loma Linda University. So Loma Linda is located in San Bernardino County, which is more inland in Southern California. It's close to the cities of Riverside and Claremont and San Bernardino. They have plenty of hiking trails within those cities, so if that's something you enjoy, great. Joshua Tree National Park is close by. It's about an hour away, and Disneyland is about 45 minutes away. So Disneyland, happiest place on earth. Not too far. So why should a student attend there? Loma Linda has a unique philosophy, which is to make man whole. Another way of saying that is whole person care, and that embodies the mental, physical, and spiritual aspects when it comes to patient care. And what's really nice about that philosophy is that it is embodied within the curriculum within the PT program. So there is definitely an emphasis on therapeutic alliance, which is being able to connect with the patient on a deeper level and not just seeing them as their medical and PT diagnosis. So student life at Loma Linda, there's a variety of opportunities to serve locally, in the community, and internationally. CAPS is in charge of the local outreach programs, whereas SIMS is the program that runs the international outreach trips. I personally participated in a SIMS trip going to Peru, and was able to serve alongside medical students, speech students, OT students, and other PT students, and was able to provide PT services and other medical healthcare care. So that was a really great experience, and all while doing that we were able to see landmarks in Peru. So I was able to go to Machu Picchu and Rainbow Mountain towards the end of the trip as we made our way home. So another aspect of student life at Loma Linda is the opportunity to network with a variety of healthcare professionals that's in school. So There's other healthcare programs like OT, speech, radiography, orthotics and prosthetics, as well as medical students. So it's a very unique opportunity to be able to network with different professional schools that you don't typically get with other PT programs. Additionally, there is the Drayson Center, which is the gym on campus. However, the gym is shared with community, which can make it crowded sometimes, but they do have a variety of different fitness classes all throughout the day, and a public pool, which is really clean. I'm a fan. I use it all the time. And then there is also an opportunity to run for student government positions within the class and within the School of Allied Health. So the Department of Physical Therapy is in the School of Allied Health, so there's different umbrellas of leadership, but there's plenty of opportunity to get involved. So pros of the PT program at Loma Linda University is its small class size. My class size is about 60 students, which is on the smaller end, so you do have the opportunity to interact with faculty on a more personal level and have the opportunity to build that mentor/mentoree relationship. Cons, I would say Loma Linda is a small town, so you do have to travel for activities. There's not much to do directly within the city of Loma Linda, so there's that. When it comes to unique features of Loma Linda, it's important to know that Loma Linda is an SDA institution, and SDA stands for Seventh-day Adventist, so that's a denomination in Christianity. They do observe the Sabbath on Friday sundown to Saturday sundown. So another con would be that everything is closed down during that time. So the library is not open on the weekends except for Sunday. Additionally, when it comes to Loma Linda being an SDA institution, there is a required chapel attendance, only once a week though, which is only about an hour, which is nice to be able to give your mind a break within the middle of the week in order to just reflect, rest, and give your mind a break from everything that's going on in grad school. Lastly, a unique feature about the PT program at Loma Linda is you have freedom to choose your sites for clinical rotation. So they don't just place you wherever. You have a choice in being able to come up with a list of what are your top 5 places that you would like to go, and then they'll do their best to get you placed in your top 1 or top 2 place that you have on your list. So that's nice. I mean, it works like that before the COVID-19 pandemic, but they're doing their best to get us placed and working super hard to get us placed, and I personally appreciate our faculty for always trying their best and looking out for our best interest always to get us to graduate on time. So that's it for Loma Linda. If you have any more questions, feel free to reach out to me via email or on Instagram. My email is zaniahbradshaw20@gmail.com or on Instagram at just_z_08.
Thank you, Naya, for that video. Guys, if you want a specific physical therapy program that has not been represented yet in the Student Speak series, make sure you comment that school below so I can find that student and hunt them down so that they can make a video for you. Alright, we're going to travel north up the Golden Coast to Sacramento, California, where we have Shireen representing Sac State.
Hi, I'm Shireen, student physical therapist from Sacramento State in California, and I'm currently wrapping up my first year of DPT school. So to tell you a little bit about just living in Sacramento, is there's pretty much anything you can think of to do, we could probably do it here. So, if you're into sporting teams, there's plenty of sporting events. If you like being out on the water, we have the American River, Sacramento River, there's lakes, Lake Natoma, Folsom Lake, a little bit to do out there if you're a water person. If you like trails, running, hiking, biking, there are plenty of trails out here for you to do that. There's plenty of nighttime, nightlife activity things to do. The bars, breweries, there are plenty of eateries out here. Almost any food you can think of, you can probably find it here in Sac. If you're big into theaters and shows and concerts, we have the Golden One Center, which hosts a lot of those. And the other nice thing about being kind of centrally located in Northern California is that we're not too far of a drive to get either up to the mountains or down the ocean. So it takes a couple hours to get up to Tahoe, a couple hours to get down to San Francisco. So you can kind of get to do a lot of fun things here in the area. As far as the Sac State DPT program, so we're a 3-year, 9-semester program. So you start in the fall. 3 years later, you'll graduate in the summer in July. And looking at those academics, your first year, you're looking at really just building that foundational knowledge. So it's a lot of hard, heavy, hitting the books, lots of PowerPoints, lots of studying. And then you move into your second year, continue to build on that foundational knowledge, and then you get to start applying some of that knowledge in some of our pro bono clinics that we offer here at Sac State. And then you get your first clinical educational experience at the end of that second year. In your third year, you're going to come back to campus, wrap up your coursework, defend your doctoral project, and then you'll finish out with your last 2 clinical education experiences. So those clinical educational experiences, I think, are definitely something a lot of the students look forward to. So we do 3 12-week placements. So that's going to be in your 6th, 8th, and 9th semesters here at Sac State, and in 3 different setting types. So in your inpatient acute care, your rehabilitation, and your outpatient. So what's nice about those is once you've built all this knowledge up, that you finally start getting to apply that, and you'd be mentored by someone who's working in that specific setting, and learn how to be a PT in those different setting types. I will say that at Sac State, what's nice about our program is how much those different clinical sites are looking for Sac State students. So I know some other programs might struggle with getting placement, but I know our instructor who handles all of our clinical education is really good at getting everyone who needs to be placed are placed. As far as those second year activities, looking forward to those pro bono clinics. Hoping those come up again, seeing as we're currently in the middle of a pandemic with the COVID-19. Things might be a little different, but I'm hoping those will still be an experience that we get as we move into second year here. So we offer 4 of those here at Sac State, and those are run by our Sac State instructors. So those will be in a neurologic for adults, a pediatric setting, an orthopedic setting, and also a pro bono clinic for individuals with amputations. So what's nice about that is in your second year, after you've built up all of this knowledge, that you start to apply those, learn how to work with patients, and you can also kind of give back to the community and offer services for those who need it. One of the other things definitely looking forward to in the program is our simulation labs. Also occurs within a second year. And that is going to give us a little bit of experience in that sort of inpatient or hospital setting. So if you didn't get that experience when you were doing volunteer work prior to being into the program, that you get to be prepared here while you're at Sac State. So you're going to get to work with a robot that's going to act just like a patient in that setting, learn how to manage tubes and lines, all the monitors that might be in there. So you really get a good experience of what that setting looks like prior to being sent on the clinicals. The other nice thing about the simulation lab is being able to have a little bit of interprofessional development, and we get to work with the nursing staff. So that way you kind of get that full well-rounded, anyone who might be in that setting, you get to work with them a little bit and learn how to work with another healthcare provider. As far as pros and cons of the Sac State program, let's say it definitely depends on what you're looking for. So some of the things I was looking for when I was looking for a program was definitely class size, our graduation rates, and the licensing exam passing rates. So at Sac State, we're fairly small. So we are a 1 application period a year, and we only take 32 students per cohort. So it's pretty competitive to get in, but that does mean once you're in that you get, a little more individualized attention from the instructors. You get to know your classmates really well, and you get to know the other cohorts really well. So again, pros and cons depending on the way you look at it. As far as the graduation rates and the exam passing rates, Sac State has really high graduation passing rate, above 96%. So it means when you're in the program that you're going to stay in the program and get your degree. And then that exam passing rate, which is really important, so that way you can actually practice once you've graduated, is, ultimately 100% at Sac State, and a majority of those students passing on the first try. So the program's really setting you up well to be successful, get that license so you can go on and practice. Other things I really like about the Sac State program is our buddy system. So you get matched up with a student who's a year ahead of you in the program. And what's nice about that is you have any questions at all, that you have someone to reach out to who's already been through everything that you're going through. So if that's, just general, you're not from the Sacramento area, you need some suggestions, living places, fun things to do, they're there for that. As far as, the academic side, they can kind of prep you ahead that if, you're struggling in a class and you need some advice, maybe what are some better ways to study, what are, study tools that they might use, that they can kind of give you suggestions on things that worked and things that didn't work for them and see if it works for you. Also notice here at Sac State that first semester, all 3 cohorts are on campus. So it's really nice the third years actually come in and check in on those first years, but actually pretty often. So they, come and see either what are we learning and if there's any way that they can suggest, study tips and tricks on how to understand the material, that they give us those. And if it was time for an exam or practical, that they come in, help remind us that if they made it through, that we can make it through. So, just keep pushing ahead, keep studying, and that we get it. The other thing I can't say enough about Sac State here is just the instructors and administrative staff. So they're incredibly attentive to all of us. Can walk through the office anytime. They know all of our names almost within the first week, which is pretty amazing. They're really quick to respond to emails, and they offer generous office hours. So if you're struggling in any way, that they're there to support you. So we're definitely expected to master the material here at Sac State, but they're also going to provide as much as they can and support, so that way we can understand and master the material. I will have to note that in light of being shifted to this whole online setting of our educational experience, that our instructors were incredibly quick to make that transition. So a lot of them, even if they had never taught online before, were definitely willing and open to learn how to provide those classes and that coursework in a variety of different ways. So that way we could be successful and keep working towards, graduation, getting that degree, and then getting that license. So I'd say, I definitely feel a sense of community here at Sac State. We're one PT family across our cohorts, and then within those instructors, you're definitely going to get, the attention you need. They look at you, not only as a student, but they're, looking at things that might be going on outside in your life. If you're an active individual and out and doing sports, they support you there. If you have families, they definitely, try to get to know a little bit about you and support you in any way they can. So that way you feel like you get a really well-rounded experience here at Sac State. So I hope that gives you an idea of what you might expect.
Shireen, thank you for that video. Guys, if you have been gaining a lot of value from this video, please don't forget to like, comment below, and share with your friends so that no one can miss this valuable content. Alright, so we're gonna go across the state to Maryland, where we have Jin representing his physical therapy school program, University of Maryland, Baltimore.
Hey, what's going on, guys? My name is Jin. I'm a second-year DPT student at University of Maryland, Baltimore. And in today's Student Speak series, I'll be covering what my experience has been like attending University of Maryland, Baltimore, and some of the things that you might want to listen into if you are considering attending our program. Justin's been doing great things with Lift for Change. Thank you, Lift for Change, for allowing me to be on your Student Speak series and allowing me to represent my school. I actually have my own YouTube channel as well. I talk about my experiences as a current DPT student and my perspectives on some of the exciting things that's happening in the PT industry. So I would very much appreciate it if you guys can come check that out. Alright, so University of Maryland, Baltimore. Let's start with some basic information. We are located in downtown Baltimore by the University of Maryland Shock Trauma Center and the Inner Harbor. We're also very close to M&T Bank Stadium, where the Ravens play their home games, and also Camden Yards, where the Orioles play. It's like a 5-minute drive, so a very, very urban setting. The buildings that we spend the most time in, like the library, Allied Health Building, where we have our classes, or Student Center, where we have our gym or the cafeteria, they're right off the exit on the highway, so you don't have to deal with too much city traffic if you decide to commute. Of course, if you decide to live close to school in the city and find a place with a couple of people, or if you can afford it, find a place on your own, definitely an easier time going to and from school. I lived across the street from school for the first 5 months of PT school because I wanted a smooth transition, and it was a great experience. I definitely plan on talking about my experience of living 5 minutes away from school in downtown Baltimore area versus commuting to and from school every day, which takes about 25 minutes. I know that a lot of us are investing huge amounts of money into our education, so commuting from home versus living near school is a legit concern. Like I said, I'll be weighing pros and cons for both options in my channel, so make sure you subscribe if you are interested in it. I know that some parts of Baltimore can be very dangerous, but as long as you use your street smarts and your common sense, you should be okay. So our Department of PTRS, we're part of School of Medicine at University of Maryland, Baltimore. But I gotta be honest here, I don't know much about other programs that aren't part of School of Medicine and are part of School of Allied Health or even school of its own. So I can't tell you guys, oh, we seek these benefits because we are part of School of Medicine, although I'm sure there are certain stuff that I just am not aware of. But I am gonna share what I know specifically about our program, so if you're still there, keep on listening. Alright, so a couple of the big picture stuff. Our curriculum is divided into 3 years. Summer, fall, and spring. So in our first year, we start with anatomy in the cadaver lab, and it's all lectures and labs in first year. Second year, we do lectures and labs as well as part-time clinicals, once a week for 8 weeks, and we have 1 part-time clinical in the fall and 1 part-time clinical in the spring. And then third year, it's all full-time clinicals and studying for the boards exam if you decide to take MPT, which is the board exam, right around graduation time. University of Maryland, Baltimore is a very research-focused school with a lot of opportunities for research. I went to University of Maryland College Park for my undergrad, go Terps, and it was like that there as well. So I think University of Maryland systems in general is a very research-focused school system. Students in our PT program get a chance to help out with research with one of the faculty members in our program that actually teaches us, so we get that exposure to research as well as an opportunity to build that connection and ask specific questions in that process. I also wanted to touch on networking and building connections as well. We have about 60 to 70 students per class, but we also have a very close community within our program and our faculty, our staff, and grads as well. I have made great friends in the program that I really didn't expect to when I first started school, have worked under and with some professors that have been very helpful and have received a lot of help from upperclassmen who are now third years, and some of them have graduated already. Again, I don't know much about other programs to tell you guys. You won't experience something that I have experienced so far in my school if you go to other programs, and which is probably not the case anyways. I can tell you though that I had very positive experience so far with people in my school. Like I mentioned already, University of Maryland Shock Trauma Center is right across the street from us, and that's a valuable resource. I've seen number of PT students work there full-time after graduating, and it's also a great learning opportunity for us because I know that we do part-time clinicals there as well. It just gets a little loud with the helicopter, but I think we're all used to it by now. Another big picture stuff, we are a gigantic school system that includes nursing school, school of medicine, pharmacy, dental, social work, and law. So you definitely get a chance to interact with other students that are studying to be in the health field. Now to dive a little deeper into academics, we do have grading system with A's, B's, and C's and D's. It's not a pass-fail. We have practicals and exams in most of our classes, if not all of them. So you do need to get 70% or above average on exams every block, and you also can't fail practicals or PBAs more than twice, or they'll have you repeat the entire year, which is kind of scary. But if you do what you're supposed to do and ask for help when you need it, I think you should be fine. Our program is set to set students up for success, not failure, which is good. Professors are very accessible via email or office hours, and that's another great strength that I see in our program. They have been very open about setting up a time to meet, either in person or virtually, and whether it's because you want to pitch them an idea and have an open discussion with them, or if you are struggling with academics, they have been very accessible. Now, just to remind you guys, I just became a second year, like literally a couple weeks ago. So all this is based on my year one experience. I have yet to find out more about my second year and my third year. But from what I know so far, I know that we offer a variety of full-time clinical sites and even part-time clinical sites for second years and full-time clinical sites for third years, from doing sports PT with D1 athletes at University of Maryland College Park, and working at University of Maryland Shock Trauma Center to geriatrics, neuro, peds, and many more. Alright, so I hope that was helpful. If you guys have any additional questions, you can go to my YouTube that's linked down below and ask me questions there. Thank you again, Justin and Live for Change, for allowing me to be in your Student Speak series. It has been super fun, and thank you guys for watching.
I hope this video helped inspire some self-change, where maybe you didn't even consider these physical therapy programs, and now you've gained some great insight and some great student experience where you're like, I actually might like it in Loma Linda, Sacramento, or Baltimore. Thank you so much for watching this video all the way to the end. Your watch time, your views, your subscriptions, your comments, your likes, all of it helps so much for the YouTube algorithm and helps my videos rank high so that everyone, just like yourself, can gain value from my videos. I appreciate it so much. If you have any questions, please feel free to comment below. And if you haven't had that school represented yet for your physical therapy school program of interest, once again, please comment that program below. Alright, y'all, thank you so much. Change people, change people. That's why we live for change people. Stay lifting, stay aloha. Have a great one, you guys.